To view a specific section of this video, please skip ahead to the corresponding times below. This video is brought to you by Autism Speaks Autism Treatment Network and Autism Intervention Research Network on Physical Health. Autism spectrum disorder is a developmental disability that can cause significant social, communication, and behavioral challenges. People with ASD process information differently, thus affecting their ability to interact socially in unfamiliar situations and settings. A trip to the optometrist office to receive a vision exam is one type of medical visit that can be challenging for people with ASD. It can often be sensory aversive, and because it's done infrequently, desensitization through repetitive visits is unlikely to occur on its own. This video will lead families and caregivers through a visit to the optometrist office. We'll show the step-by-step process of what it's like to receive a full vision exam, as well as provide insight in how to prepare ahead of time to make the visit as smooth and as productive as possible.
My name is Dr. Lotfi Maribet. I'm an optometrist. Provide comprehensive eye care for patients with specialty needs and specialty populations. We look at things like eyeglasses, contact lenses, overall health of the eye. It's very much a team approach, not just yourself and your staff, but also with the parents and the providers, and of course with the patient themselves.
Preparing for the exam.
My name is Stephanie, and I have autism and learning disabilities. Mostly I just would make sure that the person you're seeing is disability friendly, knows what autism is or whatever your kid's issue is, because I think that'll make the appointment much better. And then if the kid wants to go and see the place, ask if they can go for a visit and see the place if they've never been there before.
So when you're working with patients with autism spectrum disorder, it's again very crucial in the preparation phase to either allot time in your clinical schedule for this purpose. It could be a morning or the afternoon or a specific day of the week.
I prefer my appointments in the morning or afternoon, because by like 3 or 4, I've used up my sensory points for the day. I know, like, I'm more of a morning afternoon person, because by 3 or 4 I'm more tired. Because I've probably just been overstimulated.
Visual aids such as conversation starters, pre-visit questionnaires, and social stories are some of the best tools to help the patient prepare for the exam ahead of time. Although these are a great start, there are a number of other things families can do prior to the appointment. Visit the office website to see if there are photos of the waiting room, exam room, or staff so that you can begin to paint a visual picture in the patient's mind as to what they can expect to see upon arrival.
Is that the waiting room?
It looks like that. Or something like that.
You may even want to go to the office for a walkthrough to meet the staff and familiarize yourself with the setting, in which case you can take your own photos to construct a social story specific for your appointment.
Name is Matt.
Exam day. Make sure to bring along any and all communication instruments, including PECs, social stories, reference cards, or other electronic devices. It's also important that the person accompanying the patient to the appointment is someone the patient trusts and can rely on for support. Especially if it's the first time visiting the office, the patient's anxiety level tends to be high, and having that person at their side can help ease their concerns.
I'm Matthew, and I'm here to see Dr. Maribet.
Hi Matthew, I'm Sarah. We have your pre-visit form right here. Take a look, make sure nothing has changed. You can have a seat over there, and we'll bring you back shortly. Have a seat right there, Matthew. I'll take that from you. Thank you. And Dr. Maribet will be in just
Often the patient may have sensory issues with the office environment. It's important to adjust to their needs in order to prevent outside factors from increasing their anxiety level.
But if somebody has to get like in my face or anything, I will tell them I really don't like anyone touching my face, touching my head, getting really close to me. That really gives me like anxiety.
So when working with the patient and the parent is available or one of the care providers is available, it's very, very important to keep them part of the process. This is typically an individual that the patient trusts, and having them engaged in this helps with building that trust and rapport with the patient as well.
Hello.
Hi, Matt. I'm Dr. Maribeth. Nice to meet you.
At the beginning of the exam, the doctor will ask you questions about your eyesight.
I'm a little nervous.
That's understandable. This is the first time you've had your eyes examined?
Yeah.
We'd also like to know specifically about the individual, their level of verbal ability, how they interact, any particular devices they like to use, particular triggers, phobias we should know about is also very important to create a safe environment for them. That's very crucial. We also look at their personality. Are there things that they like, maybe TV shows, anything that allows us to connect with them very, very early on, build that trust, build that rapport.
Treatment methods differ from doctor to doctor. The methods shown in this video are used specifically for environmentally and sensory aversive patients. Consult with your doctor prior to the exam on what methods are most suitable for you.
Let's get started. At one point, you're going to have to take your hat off for me, but I'll tell you when to do that. Is that okay?
Yeah.
Excellent. Why don't you give your things to your dad and we'll get started. Okay?
Section 1. Checking your vision. In order to begin the exam, the doctor will need to turn off the lights.
So, Matt, I'm going to check your vision now, and there's a number of ways that you can cover your eye. You can use either your hand, or I can ask your dad to cover one of the eyes, or you can use the secluder. Are you comfortable with using the secluder?
That's okay.
Why don't you
The doctor will have you read the letters off the eye chart and ask you to recite them out loud as best you can.
K, S, N, V.
Good.
O, K, O, N, R.
Very good. So, Matt, I'm going to test your eye movements now. I have a little light here. What I'd like you to do is look straight ahead at this little light and keep your head as still as you can. I'm just testing your eye movements. Can you follow this light for me? All the way up and down, all the way to the side, and up and down.
The light is kind of bothering me.
Is that right? I have something else. Can you follow the little monster if I use the little monster?
Yeah.
Okay, let's try the same thing. Just follow the monster. Keep your head still. All the way up, and then down, and then all the way to the side, and then up, and then all the way down. Very good. Now, I'm just going to test your pupils. I want you to look straight off into the distance there. I'm just going to shine a little light in your eyes like this. Good. Good. Excellent. Thank you. Okay, Matt, I'm going to give you the secluder to cover your eye again. And I have some pictures here. Can you tell me which number you see on this page?
The doctor uses this test to check how well you see colors.
29,
And here?
74.
Very good.
Section 2. Do you need glasses?
Okay, Matt, we're going to take some more measurements. For this part, I need you to take your hat off for me, please.
The doctor will place an instrument in front of your eyes and ask you to look through the holes. This part of the exam will test different lenses to see what prescription works best for you.
That's it. Okay, Matt, I'm going to show you two views. I want you to compare them. You tell me which one is clearer, 1 or 2.
2.
Good. How about now? 1 or 2.
2.
Section 3. Eye health. Front of the eye.
Matt, for the last part, I'll need to put some drops in your eye.
The doctor may need to place drops in your eyes, and although they may sting for a second, they will not hurt you. However, the drops may cause your vision to be blurry or sensitive to light for a short amount of time, so consider bringing sunglasses to wear at the conclusion of your appointment.
We're going to take a look at the front of your eye.
Here the doctor may ask you to rest your chin on a different instrument so he can look at the front of your eye using a special light. It's very important to stay still during this part of the exam.
Okay, Matt, you can sit back. That wasn't too bad. That's it.
No, it's okay.
Okay, good. For the last part, I'm going to stand up here. I'm going to ask you to close your eyes. And I'm just going to rest my hands on your eyes like this for a little bit. Just a little bit of pressure there. Okay, you can open your eyes.
Section 4. Eye health. Back of the eye.
For the last part, I want you to look just straight off into the distance there.
To end the exam, the doctor needs to get very close to you with a light so he can examine the back of your eye. Once again, it's important to stay very still during this part of the
We're all
exam.
done. That wasn't too bad.
No, that was okay.
Good.
Questions and follow-up.
Okay, Matt, that's it. Your eyes look great. We'll see you next year.
Can I put my hat back on?
Absolutely. I know you were anxious at the beginning of the exam, but you did really well today. It was fun working with you. Thanks for coming today.
Thank you.
Nice meeting you.
Thank you so much.
We'll see you next year. If you have any questions, give me a call. Okay, let's go.
So it's important that the patient feels comfortable following up with any issues with myself directly or my staff. My staff understands that they should be able to reach the parent or the individual if there's any follow-up issues, the results of exams, for example. If the patient also has concerns or follow-up issues, they should feel comfortable either by phone or by email or whatever they're comfortable with in communicating with the clinic or myself directly so that we can answer any follow-up questions or concerns after the eye exam. And finally, it's important to think about that their expectations are met. They should be able to feel that they leave in a manner that their questions have been addressed and that they're leaving with the best possible functional vision that they can. It's also important to think about that not everything can be addressed in one setting as well, and that might just be one of multiple visits. There might be scenarios where a few minutes are needed to have the individual get comfortable, and that can be addressed by having them go to another room or have you step out and come back later, or just simply saying that we can't accomplish everything in this particular visit, would like you to come back in a few days, and that's your second opportunity or third opportunity to get all the assessment questions that you have.
To-do list. Consider doing the following before your vision exam. Prepare for the visit with communication starters or a social story. A social story is a narrative with pictures that includes the patient in the story and shows the steps included in a new experience or activity. Visit the office website to obtain pictures of the building, waiting room, exam room, and any staff the patient may meet. This will help the patient gain familiarity with the doctor's office, to decrease anxiety, or to gather photos to create your own social story. Visit the office a day or two before the exam to do a walkthrough. If applicable, remember to bring the patient's method of communication. This could be PECS, a communication board, or an electronic device. Consider alerting the office ahead of time about the patient's needs. Let them know your child has an autism spectrum disorder and may need a quiet space and more time for the exam. Suggest the optometrist view this video before the appointment. And lastly, at the end of the visit, make sure there is a method for follow-up in case you need more information.